This is a presentation regarding the reuse policy of cataract surgical instruments. What is a single-use device? A single-use device is also known as a disposable device. It is intended for use on one patient during a single procedure. It is not designed or validated for reprocessing, that is cleaning, disinfection and sterilization for use in another patient. So this is the symbol for do not use or single-use instrument. These are the list of surgically reusable devices. So first is the hydrocannula, vitrectomy probe, silk thread, superior rectus needle, knife, rhexis needle, eye shield, syringe, Simcoe cannula and tube, and iris hook. Safety issues may compromise with their intended function, may not be designed to allow thorough decontamination and re-sterilization processes. Long and narrow lumen instruments, acute angles, coils, etc. Example, vitrectomy cutter. Potential cross-infection, endotoxins can cause some inflammation. Also, exposure to chemical agents such as cleaning agents and chemical sterilants may cause corrosion and changes in the materials of the device. Exposure to elevated temperatures or pressure during the sterilization process may also alter the properties or cause degradation of the device material. For example, plastics may soften, crack or become brittle. These are the reprocessing steps which are used for all the instruments. First is disassembling, decontamination and cleaning, inspection, testing, packing, relabeling and sterilization. Now you will see regarding the reprocessing of a hydrocannula. Take 3 sterile basins, fill RO water in 2 basins and keep 1 empty basin. Keep the instrument in first basin. Fill a 5 cc syringe with RO filter water and second basin from the second basin and flush it in the empty basin from the cannula one time. Take an empty syringe and flush air one time into the hydrocannula. Wash the cannula after every case. Method of sterilization is autoclave. Number of reuse or cases is until the end of the day. Disposal, daily disposal or end of the day. So here we see that we have taken 3 basins. 2 basins are filled with RO water and we have an empty basin. Take RO filter water from the second basin and wash the hydrocannula. The hydrocannula should be flushed, the entire syringe should be flushed in an empty basin. Then the syringe and the cannula, they are washed with air. Now we will see reprocessing of vitrectomy probe. Turn on the visco mode in the phaco machine. Take a bowl filled with saline and put the probe in the bowl. Press the foot pedal for washing the probe till the bowl is empty. Dry the probe after taking it outside the bowl. Wipe the probe with sterile wiper. Close the vitrectomy tip using the cap. Seal the probe using the ETO sterilization pouch. Method of sterilization is ETO. Also mention the date of ETO and the number of times it is used on the pouch. Reuse is 10 times and disposal after 10 uses or when not effectively cutting the vitreous or aspirating. So now here we can see that there is a bowl in which now we have to clean the vitrectomy probe. Clean it till the bowl is empty. After attaching it to the phaco machine, the cutter is then taken and it is cleaned using the RO filter water in the bowl. Also the foot pedal is pressed during that process. We can see the parameters in the phaco machine. It is done in the visco mode. Do it till the bowl is empty. Also, the foot pedal is pressed continuously during that entire process. We can see that the phaco machine is in visco mode during this time. Now the probe is cleaned. Take a gauze and gently wipe it and clean the cutter along with the tubes. The entire cutter and the tube is cleaned gently. Wipe the ends properly. Close the vitrectomy cutter using a cap. Send it for ETO. Label it and then pack it. This is the packaging which is done for the instrument. Confirm that the packaging and the sealing is proper. Also label the reusable items. Now we will see the reprocessing of 440 silk thread. Separate the thread in a different tray. Take one basin filled with RO filter water and clean the blood stains. The procedure is repeated after every case. Method of sterilization is steam autoclave. Reuse and disposal, we have a daily disposal system. So here we can see that the thread is dipped in RO filter water. All the blood stains are gently cleaned. The entire thread is cleaned and the blood stains are then washed off. This procedure is repeated after every case. Now we will see the reprocessing of superior rectus needle. Separate the needle in a different tray. Take one basin filled with RO filter water. Clean the blood stains. The procedure is repeated after every case in between the cases. At the end of the day, clean with ultrasonic cleaner for 3 minutes. Take needles in one basin filled with RO filter water and wash lightly. Then dry the needle with hand towel. Method of sterilization is steam autoclave. Reuse and disposal. For the thread, we have a daily disposal system, and needle, it is a weekly disposal system. We can see that the needle is separated. It is kept in a basin filled with RO filter water. Wash the blood stains carefully. Clean the needle gently. And the procedure is repeated after every case. All the needles are then taken into one bowl, separated from their threads. Keep it in RO water, clean it gently. Then it is sent for ultrasonic cleaning. The ultrasonic cleaner is then used for 3 minutes. This procedure is done at the end of the day for all the needles together. As soon as the process is over, remove the bowl and the needles from the ultrasonic cleaner. Again, wash it with RO filter water. Keep it on a cloth and dry it. It is then ready to be attached to the thread. Now we will see the reprocessing of knife, that is a crescent, keratome and a side port blade. Take one basin filled with RO filter water. In the basin, remove the cap on the knives and gently clean the front and back of it with a brush. Method of sterilization is autoclave. Reuse and disposal is daily disposal, or when the tip bends or becomes blunt, maximum 5 times we can use it. This procedure is done for free and camp section. For paying section, 1 knife is used per case. So now here we can see that there are 3 basins, 2 filled with RO filter water. We can take an empty basin. All the knives are first kept in one bowl or a basin. Remove the cap then wash or clean all the knives with a brush. Again reattach the cap and keep it in a separate tray. Repeat the procedure for all the instruments, all the knives, that is the crescent, the keratome and the side port. Apply cap on all the instruments and repeat this after every case. Now we will see the reprocessing of Rex's needle. Take 3 sterile basins, fill RO water in 2 basins and keep 1 empty basin or tray. Keep the instrument in first basin. Fill a 5 cc syringe with RO filter water from second basin and flush it in the empty basin or tray 1 time. Take an empty syringe and flush air 1 time. Wash the needle after every case. Method of sterilization is autoclave. There is daily disposal for this Rex's needle, and this procedure is done for free and camp section. So here we can see that there are 3 sterile basins, 2 filled with RO filter water and 1 empty basin. Take RO filter water from the second basin, attach the syringe to the Rex's needle and flush it in the empty basin. This procedure is done once. Make sure the entire syringe is empty. After that, the syringe and the Rex's needle is flushed with air. This procedure is done after every case. Reprocessing of a syringe. It is done for 5 cc and 1 cc syringes. Take 2 basins filled with RO filter water and an empty tray or basin. Keep syringe in the first basin. Aspirate RO water from first basin into the syringe and flush it out in the third basin or tray. Then aspirate RO water from the second basin and flush in the third basin or tray. After wash, separate the syringe from the plunger and send for sterilization. This is done after every case. Method of sterilization is autoclave. Reuse and disposal is a daily disposal, or if there is any melt or leak in the syringe. So here we can see that we have 3 basins, 2 basins filled with RO filter water and 1 empty basin. So the syringe is filled with RO filter water from second basin and emptied into the third one, and again filled with RO filter water in the first basin and then from the second basin and then emptied into the empty basin. This procedure is done for all the 2 cc and the 5 cc syringes. Separate it from the plunger and send it for sterilization. Reprocessing of Simcoe cannula and the tube. Take 2 basins filled with RO filter water and 1 empty basin. Keep Simcoe cannula in the first basin. Aspirate RO water from second basin into the Simcoe and flush it out. Repeat this procedure 2 times in between cases. This will clean the tube and the aspiration port of the cannula. Now aspirate RO water from the second basin into the irrigation port of the cannula and flush it out. This procedure is repeated 2 times. This will clean the irrigation port of the cannula. Take an empty syringe and flush air 1 time into the cannula and tube to dry it. At the end of the day, this procedure is repeated 5 times. So aspirate RO water from first basin into the Simcoe and flush it out in the second basin. Aspirate the RO water from first basin into the irrigation port of the cannula and flush it out in the second basin and repeat the procedure 5 times. Clean the entire Simcoe cannula and the tube with a compressor at the end of the day to dry it. Method of sterilization is autoclave, reuse and disposal for the cannula till it condemns or if there is any block in the ports. For tube, weekly once. Here we can see that there are 3 basins. We have a Simcoe cannula and we have a syringe. So, take RO water, fill it in the syringe, attach it to the aspiration port, flush it out once. Again repeat the same procedure. Now do it with the irrigation port. Flush out the RO water. Make sure the entire syringe is empty. Take air and flush it out first in the aspiration port and then in the irrigation port. This procedure is repeated 2 times after every case. Reprocessing of iris hook. Take RO water, 5 cc syringe, 20 7 gauge cannula in a sterile tray. Fill 5 cc syringe with RO water, apply cannula and hold the hook in the other hand with forceps. Wash the hook with light force of water using the syringe and cannula, repeating it 5 times. Blood stains over hooks should be washed thoroughly with forceful spray of water. Wrap the washed hooks in a banyan cloth to allow it to dry. Dry hooks should be kept in the iris hooks box using a forceps. Method of sterilization is ETO. Wrap the cleaned and dried hooks in ETO sterilization pouch and pack it. Put the reusable sticker on the back of pouch. It should contain first usage of hooks, number of times used, OT name and name of MLOP sister. Reuse and disposal till it condemns and maximum 10 times. So this is the iris hooks box which is there. You hold the iris hook gently with the forceps. Wash it in the RO filter water. Make sure the blood stains are washed nicely, thoroughly. Use a syringe also to clean the cannula and the hooks. Keep it in a banyan cloth. Leave it to dry. It should be packed thoroughly in the iris hooks box. Gently place the iris hook in the box one by one. Pack it properly. Make sure it is sealed in a proper way. Place it in a sterilization pouch with the labels. Packaging is then done. Apply a sticker on it. The sticker is applied on all the iris hooks box for reusable items. Number of times used and last use date is mentioned, name of the packing MLOP sister is mentioned, and date of first usage is also mentioned above. This photo shows the packing of the instruments. So we have a label which shows how many times the instruments have been used, and after the maximum number of time to be used, you have to dispose it. Recommendations and best practices: gentle handling, adherence to proper cleaning protocol, and sterilization methods can ensure the availability of instruments that are safe for reuse. Continuous monitoring of reprocessing protocols should be ensured. Number of time used on patient should be continuously monitored and disposed at the recommended usage time. Thank you.